Do you know that in 2015, an estimated 47 million people worldwide were living with dementia? This staggering number reflects the profound global impact of this neurodegenerative condition. In the United States alone, approximately 5.7 million people were living with Alzheimer's dementia that same year, making it one of the most significant public health challenges of our time. Dementia, a term used to describe a group of symptoms affecting memory, thinking, and social abilities, is not just an individual struggle. It affects families, caregivers, and entire communities. The growing prevalence of dementia has sparked concern among medical professionals, researchers, and policymakers alike as they strive to understand its causes and find ways to slow its progression. As the population ages, these numbers are expected to rise dramatically. By 2050, the global number of people with dementia is projected to triple to over 152 million. This makes it even more crucial to focus on early detection, preventive measures, and understanding potential risk factors, some of which may surprise you. For instance, did you know that certain medications or drugs might increase the risk of dementia? While most people associate the condition with aging or genetic predisposition, studies have shown that prolonged use of specific medications could play a role in cognitive decline. This revelation underscores the importance of being informed about the potential side effects of drugs we commonly use and understanding how they may impact brain health in the long run. In this video, we'll explore 9 commonly used medications that could contribute to dementia, uncovering how they interact with the brain and why it's essential to approach their use with caution. Stay tuned to learn more about this vital topic that could help protect your cognitive health and the well-being of your loved ones. Just a quick reminder, the information provided in this video is for educational and informational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider before making any changes to your diet, lifestyle, or health practices, or before using any new remedies or treatments discussed in this video. So let's dive in. 1. Anticholinergic drugs. Anticholinergic drugs are commonly prescribed for various conditions, including allergies, depression, overactive bladder, and even sleep disorders. These medications work by blocking the action of acetylcholine, a key neurotransmitter involved in memory, attention, and learning. While they can provide relief for specific symptoms, mounting research has uncovered a concerning connection. Long-term use of these drugs may increase the risk of developing dementia. This isn't just speculation. Scientific studies have shed light on this alarming trend, making it something we need to talk about. A groundbreaking study published in JAMA Internal Medicine examined over 300,000 participants and found that those taking anticholinergic drugs for extended periods had a significantly higher risk of dementia. The risk was especially pronounced in individuals taking strong anticholinergics, like antidepressants and bladder medications. Researchers believe this occurs because acetylcholine plays a crucial role in the brain's cognitive functions. When anticholinergic drugs block this neurotransmitter over time, it may lead to brain changes, including the buildup of amyloid plaques and tau proteins, both hallmarks of Alzheimer's disease. Number 2. Bladder control medications. Drugs like oxybutynin and tolterodine are commonly prescribed to treat overactive bladder, a condition that affects millions of people, especially as they age. These medications help by relaxing the bladder muscles, but they also block acetylcholine, which is why they're linked to cognitive decline. A study conducted by the University of East Anglia found that people who used these medications for several years had a heightened risk of dementia, especially those aged 65 and older. This is because the brain depends on acetylcholine for memory and learning, and blocking it repeatedly can lead to long-term damage. If you're struggling with bladder control issues, talk to your doctor about safer alternatives. 3. Antihistamines. Over-the-counter antihistamines, like diphenhydramine, commonly found in Benadryl, are widely used to treat allergies and insomnia. While effective, These first-generation antihistamines are potent anticholinergics, meaning they block acetylcholine and can disrupt brain function over time. A study in the BMJ indicated that regular use of first-generation antihistamines in older adults was associated with a significantly higher risk of dementia. The problem lies in the ease of access. Many people take these medications for years without realizing the potential long-term risks. If you rely on antihistamines for allergies or sleep, consider switching to newer, second-generation options like loratadine, which do not cross the blood-brain barrier and have minimal cognitive side effects. For sleep, developing better bedtime routines or using non-drug approaches may be safer alternatives. Awareness is your first step toward protecting your brain. 4. Benzodiazepines. Commonly prescribed for anxiety and insomnia, benzodiazepines like diazepam, Valium, and lorazepam, Ativan, have raised concerns due to their potential to increase dementia risk. These medications work by calming the nervous system, but they can impair memory and cognitive function when used over extended periods. Studies published in the BMJ and Neurology have shown that prolonged benzodiazepine use, particularly in older adults, correlates with a higher risk of dementia, likely due to changes in brain plasticity and neurotransmitter function. If you're using benzodiazepines regularly, it's important to have an open conversation with your doctor about tapering strategies or exploring safer alternatives. Cognitive behavioral therapy for anxiety or melatonin for sleep might provide similar benefits without putting your brain at risk. Always prioritize your mental well-being, but be mindful of the long-term consequences. 5. Sleeping pills. Drugs like zolpidem, Ambien, and esopicolone, Lunesta, are widely used to treat insomnia, but studies have linked their long-term use to an increased risk of dementia. These medications, sometimes called Z-drugs, work by slowing down brain activity to induce sleep. However, they can interfere with the brain's natural processes for repair and memory consolidation during sleep. Research published in the Journal of the American Geriatrics Society found that older adults using these drugs regularly had a higher risk of cognitive decline over time. To improve sleep without the risks associated with these medications, consider natural remedies. 6. Proton pump inhibitors, or PPIs. Commonly used to treat acid reflux and heartburn, medications like omeprazole, Prilosec, and pantoprazole, Protonix, have also been linked to dementia risk. PPIs may alter gut microbiota and reduce the brain's ability to clear toxic proteins, contributing to cognitive decline. A study in JAMA Neurology reported that prolonged PPI use in older adults was associated with a higher risk of dementia, particularly in those taking high doses for extended periods. If you're using PPIs, it may be worth exploring dietary changes or alternative medications that can manage acid reflux without compromising brain health. Short-term use is generally safe, but prolonged reliance should be avoided whenever possible. 7. Parkinson's disease medications. Drugs like benztropine, used to treat Parkinson's disease, are anticholinergic and can impair cognitive function over time. While they are effective in managing tremors and rigidity, these medications also block acetylcholine, which is crucial for memory and attention. Studies have shown that people with Parkinson's disease who take anticholinergic medications are more likely to experience cognitive decline compared to those who use non-anticholinergic treatments. If you or a loved one has Parkinson's, work closely with your healthcare provider to explore safer treatment options. Newer therapies with fewer cognitive side effects are available and may better protect brain health. Balancing symptom management with cognitive preservation is vital in these cases. These medications serve important roles, but understanding their risks helps you make informed decisions. Always consult your doctor to explore alternatives or reduce dependency when possible. Remember, safeguarding your brain health is a lifelong commitment. Thanks. Kindly share and subscribe for more.